All right, so our special guest for today is we have a medical doctor, founder, and CEO of Pediatric Works LLC. Without any further ado, let me put up one more graphic before there we go. We have Dr. Kimberly Works, founder and CEO of Pediatric Works, with us today. And I want to put on my podcast style headphones right here. I wanted to look, oh yeah, I can hear myself. I want to be as official as possible. Dr. Works, good morning. Welcome.
Good morning. Thanks for having me.
Okay. Thanks for being here. I appreciate it. So, founder and CEO of Pediatric Works. So, what does that mean anyway?
So it means that I went on a journey, stepped out on faith, and opened up my own practice. I'm in Atlanta, Georgia, so I launched my practice this January to do something a little different.
Yeah. Um, yeah. So it's founder CEO Dr. Kimberly Works MD. So that MD stands for medical doctor, right?
Yes, it does.
So if so if we're on a plane or something and something happens and somebody, is there a doctor in the house? They literally talking about you.
They are. They're asking for help. Yes.
Very good, very good. So now that we've got the people's attention, I want to all my viewers, 1 second, Dr. Works, talk to the viewers again. I want you all to share this video right now. Stop what you're doing, share this video. If you got kids, nieces, nephews, grandkids, I want them to come watch the video right now because we have a pediatric doctor, and we'll get into that momentarily. That's going to be talking directly to the kids and to the adults, to the parents. This is something you need to hear.
No pressure.
Also, let me show you all how to share because I think some of you guys don't know how to share on YouTube. So if you're on YouTube, if you're looking at the video right now on YouTube, do this with me. All right. Here's an example video. If you see this little symbol right there with the little circle that I got circled, hit that button right there. Or sometimes it's another one that actually says share. Stop what you're doing right now, hit that share button and send it to as many people as you can. All right. You see that symbol? All right. If you're on Facebook, if you're watching on Facebook, you see where it says share, hit that button and share it right now. And Dr. Works, if you give me just a moment, I'm going to do the same.
Yes, I just shared as well.
All righty. So Dr. Works is sharing the video. I am sharing it as we speak. Share with friends. We did it. And we're back. So all the viewers, you should have shared it by now. You should have brought your kids in. This is information that's going to benefit you and your kids, your nieces, your nephews, and all that good stuff. All right, Dr. Works, back to you. So you're a pediatric medical doctor,
Yes.
practicing doctor. So pediatrics, just to kind of dumb it down in a way, what is that? What does that mean?
So, pediatrician is someone who's dedicated their lives to the health and well being of children. So, typically, we start from birth. Sometimes we are actually in the delivery room, and we go up to 18, and some go up to 20 years of age. Those are the children that we take care of.
Okay, so all right, very good. And the reason I asked you specifically, like for day today, because down here in Florida, um, we got kids that either have started 1 week of school already, or this is going to be their first week actually physically at the school. What's it like up there in Georgia right now? Have they started school?
They have, I think, the last week or so. We have schools that are in session going to class, and there's some that are virtual, and there's some that are doing the hybrid, which means they are on video or webcam a few days a week, and then the other days they're in the classroom setting.
Okay, that makes sense. And and I guess ideally for most people, because of this thing that we're going through, and we'll get into that. Ideally, it'll be better for them to stay at home completely, but feasibly, realistically, that's not really possible for everybody, if that makes sense.
It isn't correct.
Okay, very good. So let's jump right into it. That whole thing that we alluded to just a moment ago is this COVID-19, um, and I'm gonna keep it real simple for me because I'm not a doctor, I'm not an MD, and not only that, I don't watch the news. Uh, so it's a lot of stuff I just don't know or barely heard. Don't
Mhm.
hit me, Doctor Works. Um, so what is this COVID-19? What's the and it if you know if you don't, why is it 19? Is it was it 18 other versions of it or you know what I mean?
So COVID-19 is a virus that we have been in the US, I think, since January. I think first it was found in China, I think in December. Don't quote me on that. But basically, it's a viral illness that's typically for most people, they have symptoms of runny nose, sneezing, coughing. That's how most people present. Specifically, that's how most children present, and or they're asymptomatic, meaning they have no symptoms. And I'll talk more as a pediatrician about the kids aspect. Essentially, about 90% of kids are fine, meaning they have no symptoms. They look like me, but they are able to pass the virus to other people, or they have runny nose, sneezing, coughing, so they look like they have a cold, just like most kids look like 90% of the time of the year.
Okay, that's interesting. Because I do hear that word asymptomatic, um, and because of that, that basically means there's no symptoms, like you said, right?
They don't have any symptoms that you can see. They
That
don't
you can
have the
see,
runny nose, sneezing, coughing. They don't have the headache. They feel perfectly fine.
and there's no real rhyme or reason, basically, right now that we understand of why that is, basically.
So this is a virus. So virus is going to impact everyone a little differently. And so that's essentially what it is.
Okay, let me pause one more time, Dr. Works, and for our viewers, since you know where we're going with this now, if you have any questions online, go ahead and write it in the comments if you're on Facebook and or YouTube. Do not call this line because we ain't opening up to you. But write it on Facebook and YouTube. Any questions for Dr. Work? Um, okay, so since a lot of people you said or a lot of kids are asymptomatic, what makes it so dangerous? Like I'm 37 and I've never heard of anything during my lifetime being so talked about. What makes it so dangerous?
It's talked about so much because this is the first time we're actually seeing it. Things like flu or, I don't know, adenovirus, things like that, we've known for years. This is a novel virus, something that is brand new. And so we're actually learning about it on a daily, if not hourly basis right now. And that's why it's scary, because this unknown is scary.
The unknown, yeah, the unknown is usually scary. So basically, we're not even a year into this virus almost.
Correct.
So how has our hard knowledge of it or understanding of it changed from when it first kind of started versus now? Because I can remember kind of hearing things like off in the distance, okay, this is in China, this is in Italy.
Hmm.
And then next, it seemed like next thing you know, nah, that thing here, like
Hmm.
it's
Hmm.
it's knocking on
Hmm.
the it's knocking on the door. So I'm sure like the learning curve, you know what I mean? How's that changed? You know what I mean? If that
It
makes sense.
changed a lot. You think about it. Remember, there was one point in time where the CDC wasn't recommending masks, and now they are. So we've learned a lot. We've learned how it spread. We've learned how easy it is spread. One of the things we're learning more is about children. Initially, we knew nothing about children until I think March. There's an article came out from Italy that gave us a little idea what was going on there with children because they were hit faster and sooner than we were. And so we learned a lot, meaning like 10% of children have a really, really poor outcome, meaning 10% of children are the ones that are hospitalized. And I think 1% are the ones that need a little bit of help with respiratory support. So we learned a lot along the way. We also learned that some kids present with like a Kawasaki appearance,
Can you
meaning
say that one more time, Dr. Works?
Kawasaki appearance, where their blood vessels and stuff are enlarged. And so we're learning about it on a daily basis. But the main thing for the viewers is how to protect themselves. Why, while us, the medical community, are learning more about it.
Right. And we'll get into that protection also. But you mentioned the spread of it.
Mm-hmm.
So I've heard different things. Like I said, I don't watch the news, but I hear things.
Mm-hmm.
And I'm wondering, you mentioned how it's changed. I remember hearing airborne. And then, and back in the day, I'm saying this like this was years ago, but
Yeah,
earlier it was like, it feels like this thing been going on
we
for a
want this a long
long
time.
time. Um, but early on, I remember, hey, glove up, glove up. I don't hear that as much now, but I hear the mask now.
Mhm.
What do you think, based on what you know now? And I know this is changing, so might not be the same. How does it spread? Is it airborne? Airborne, like one little droplet, or is it kind of airborne but mostly touch? Is it metal surfaces? You know what I mean? Like,
So it's airborne, meaning it comes out of your mouth, come out of your nose, and then it can go on surfaces. So if it hits your table and you come and wipe your table and you touch your nose, touch your mouth or your eyes, that's how it's transmitted. But it's respiratory droplets. So when you talk, when you're singing, when you do anything with your mouth, that's spreading the virus out to other people.
so it's less likely, say, for example, if I was to have it, the virus, and I touch something and you touch that, it's less likely to get it, or it's more likely like if I say something and then those droplets hit what, you know what I mean? If I give you a
Right.
handshake and I got the virus, you got it because of the handshake, or which came first, the chicken or the?
So yes, it's more contagious coming out of your mouth and nose and so forth. You can get it off surfaces that you're asking, which is called formites. You can get it off surfaces, um, but the chances are less. But when it hits a surface, it's not just hitting the surface; it's the fact that you also are touching your eyes, nose, and mouth. That's why you're getting it into your body. So it can be on my countertop right now. If I'm not touching it or touching my face, then there's nothing to worry about.
Okay, since you've mentioned basically that mouth and face thing, let's go ahead and go down that, like my brother say, rabbit hole. And also, let me pause one more time and let me mention the pastors of our church,
Yes,
uh, also doctors, but not medical doctors. Dr. Celestin be on duty and Dr. BJ be on duty. My dad is in the front row. He told me to point at him, let him know he was watching.
that's my family.
And reminder for the viewers, if you have any questions for Dr. Kimberly Works, please type them in. We'll get to those a little later. And Dr. Works, if I forget, remind me. We'll bring somebody on, but not yet. But okay, so back to it. I've noticed you've mentioned a couple times touching your face, touching your eyes, this area. Is that seems to be like a more a widely accepted view of the easiest way to get it, basically by touching your face. Um, how you feel about that?
It's another way of getting it. Yes.
It's another way. Okay.
Mhm.
So um, here's a scenario. I go to the grocery store. All right. I'm touching stuff, um, touching groceries, touching produce, fruit. To be safe, it's best that once I get to somewhere like back in my vehicle, sanitize myself the whole time, make sure I don't touch this, and that's a safer way to not get it.
So you're in the grocery store, you need to make sure you first of all you have a mask. And so we would recommend not to have a lot of things in your hand. And that's why we have a lot of places where you go where it's like cashless or electronic pay. And don't have your keys because these are things that you're touching and you can then take home and then shop like you normally shop. We kind of recommend for the general public not to wear masks because you guys are kind of not trained on masks. And so I see people with masks on in the grocery store thinking they're prepared and they're protecting themselves, but at the same time they're on the phone or they're adjusting their glasses and stuff like that. So the gloves are only used for a short period of time. So we kind of recommend for you not to have anything in your hand, anything extra. Shop the way you would shop. Obviously, stay 6 feet apart from someone. Don't cross anyone in the aisles and so forth. All the arrows. And then when you get back to your car, wash your hands and so forth. But even at the register as you're leaving, wash your hands because a lot of places have hand sanitizer now.
Yeah, I want to talk about those masks, man. Them masks be making me mad for one reason, right?
Hmm.
And you mentioned they're not wearing it right. So I wish I had a mask nearby. You'll see people
Have a
with
mask.
masks down here, like it's a chin guard.
Yes.
Um, don't get me started. And to me, like you said, if you're not wearing it right, and then all you're doing is keep touching it and keep adjusting it, and then that stuff you were just touching on is on the mask, and then you're taking the mask, and then you're here with it, and then you use those same hands that you was just touching the
Right.
mask with, like you said. Okay, I agree with you.
So I do have a mask. So your
Oh
mask,
yeah. Okay,
um,
yeah. Give us a demo.
is very easy. I mean, it
Matter
doesn't
of
have
fact,
to. This is the
before you do that, I'm gonna minimize myself so you can be
you see
take the
me.
whole screen and people can see. All right, go ahead.
So this is just a mask. Dr. McStuffin, a mask, any kind of mask, anything is better than nothing. It can be a cloth mask. It can be a medical mask. It can be a surgical mask. The main thing is or a scarf. The main thing or a bandana. The main thing is you have a mask. And so basically, it's very simple. You want to pass over your ears, your nose should be covered. A lot of times there's like a little metal clip that you can pinch, cover your mouth, your nose, and this is how you wear it. Your mask here, all this on the outside is considered contaminated dirty. So you never touch this side. So essentially, once you have your mask on, you leave your mask on until you discard it in the trash can.
You know what? Now that you say that, I gotta apologize to some people I've been seeing. Then, because another one thing I hate, but the way you just explained it makes more sense now. I hate seeing people. See, I'm not a medical doctor.
Okay.
Dr. Works is, but I hate seeing people in their vehicle by themselves with a mask on. But based on what you said, they could have just came from somewhere, and to prevent contaminating themselves more, they
Mm-hmm.
might be leaving it on there. So in
Right.
other words, I was wrong.
No, I typically a lot of times I leave my mask on even in the car because it's easier for me anyways. So I'm not continuously touching on the outside. You're still going you know, grocery shopping or something like that. So a lot of times I leave it on, and then I'm also kind of used to wearing masks, so it doesn't really bother me as much.
Very good. Okay, Dr. Works, let's transition back to our core audience. Hopefully, right now, these parents
Mm-hmm.
with kids that's just starting school, a weekend, maybe first week, actually going to the school, maybe hybrid, and to the students. I got nieces and nephews. A lot of our viewers have kids, grandkids, cousins, young people. Let's kind of target them specifically, which that is your specialty. So, like we said, a lot of these kids parents, they're starting either this week or they just started last week. And that unknown that you mentioned before, it can bring fear. Let's just be honest. Fear because it's so much unknown, and fear because parents want to keep their kids safe. I want to keep my niece and nephew safe. Um, so for the people that's starting school and just started school, what should they focus on to make sure they're as safe as possible, even though it's a lot of people at school?
Okay, so one of the things we need to remember is that we are all Christians, so we need to pray over our children and pay that we're making the right decisions. And then every decision is going to be individual, right? Every family dynamic has a different dynamic, and so there's some kids who are special need, or there's some kids who need extra help. Those type of services are not going to be given online, so you may have to take your child to school, or it could be something as you might not be able to afford. Computer or Wi-Fi, and so your children need to go to school to continue their education. So every decision is going to be your decision for your family, and so that's one of the things I've noticed, that people are getting a little stressed out because they're worrying what their neighbor's doing, but it's not what their neighbor's doing, it's what's best for you and your family and your child. So what a lot of schools are doing, schools are trying their best. They're having split classes, or having some virtual, they're having some in session, they're spacing out the classrooms, they're cleaning, they set up their cleaning regimens. One of the things you can do is pray with your children, make sure they're comfortable and used to wearing a mask. At this point, I think everyone should be used to wearing a mask. Mask could be on anyone over the age of 2 years. Used to wearing their mask, used to not touching it, teaching them not to touch their face. I mean, these are things that we should have already been doing, but this pandemic is kind of reminding us that we need to stop and wash our hands, because a lot of people, we weren't. So have their mask. They can have a little sanitizer bottle in their book bag when they come home from school. Maybe instead of hugging them and so forth, maybe have them go and take a shower and discard those clothes. And so there's little things that you can do for a peace of mind, but just know that whatever you are doing is for your child and your family only.
Okay. And I'm glad you mentioned sanitizer. I didn't even think about that. So you like the idea? Of course, well, not of course. I'm not a medical doctor. Let me say that.
Oh.
But I believe that washing of the hands is preferable. But you do like sanitizer? Talk to me about that.
Yeah, so ideally, washing your hands is the best thing to do, but there are times where you can't wash your hands, and so it's good to have sanitizer with you in your purse, in your book bag. I carry like these, when you can find them, these little wet ones, because I like the wet ones, little cloth,
Yeah.
and they're sterilized. So yes, washing hands is always going to be preferable, but there's going to be times you can't do that.
Okay. Now, reminder to the viewers, if you got any questions, comments, concerns you want to ask Dr. Works, write them in the comments. Don't call my phone. I ain't going to answer. Uh, and now you mentioned also, so when they come home from school, you suggest um, like put them in the shower or so that's basically like a decontamination process.
Yeah, I don't see anything wrong with that. That way you can at least separate, have them change their clothes. A lot of times when I'm working, when I come home from work, I do take a shower and so forth, before touching my dog, because I have a dog. And that is just one, you can make you feel a little bit better, I would think. And then two, if there is any kind of fomites or anything on your clothing, you could be getting them off and not transmitting them through the rest of your house.
What's that word you just said?
Fomites. It's just when the bacteria is on a virus, or bacteria is on like an object.
Okay.
Of some sort.
So that kind of, okay. So it'll lessen the chance of that being spread around the house.
Mm-hmm. So just have them come in the house and go take a bath, and they take a bath and put whatever, clothes their nightgown or whatever it is that you want them to lounge around in. Just another step, another peace of mind.
Very nice. Again, we're talking to Dr. Kimberly Works, founder, CEO, Pediatric Works. I don't think I said this. You're not here in Florida.
No, my family, your other side of your family, we live in Atlanta.
Oh yeah, I didn't say that either. So how do I know Dr. Works? Dr. Works is actually my cousin,
Hmm.
my blood cousin,
Blood cousin.
not play. Her, uh, wait, somebody messaging? Okay. Oh, okay. Philip just shared our post.
Philip.
Philip, shout out to you. Thanks for sharing. If you haven't already done so, share it. If you got kids that aren't around, they're playing a game, put the game up, have them come in and listen. Um, so Dr. Works. So let's do a what if, all right?
Okay.
What if I got it? Or what
Mm.
if I think I got it? All right. Now what?
So if you think you got it or been around, been exposed to someone who has it, one of the things you want to do is stay at home. You want to stay home for at least 14 days to make sure you're not transmitting to other people. If you're able to get a COVID test, that's great. Typically, you want to wait 3 to 5 days until you think you had it to make sure the test is going to be a little bit more efficient. But the main thing is you want to stay away from everyone else. And then everyone in your household, you're going to assume that they have it. And so it's not just you, it's your husband, your kids, everyone, because you're around them, right? You can't have 6 feet away from your husband or your children. And so if your child comes in and you think there's an exposure, it means the whole house has been exposed. And so the whole house needs to self quarantine,
I didn't even think about that.
the whole
Just
house.
assuming everybody else got it. That could that makes sense. That proximity. Now that 14 days. What what's up with that 14 days? Where do you
It's
get that number from?
Yeah, it's 10 to 14 days essentially.
10 to 14. Okay.
Yeah, it depends. And now I'm trying to remember because it's been a couple months now. It just depends how long it's how long you are can still pass on the virus. And so there is a time frame that we're thinking that you can still pass on the virus. So if there's a possibility that you're still passing it on, that's when we kind of want you to be by yourself somewhere.
Yeah. Okay. Yeah. Because sometimes when think of these numbers, where they get these numbers from? Why is it 6 feet and not 10 feet? Or why
That's
is
all the
this?
researchers.
You're right. And I'm sure things have changed, like we talked about earlier.
Mhm.
And then you also mentioned the test. Um, I got tested. Thankfully, it was negative. I got a test which was basically this long Q-tip,
Mhm. Mhm. I
and
know.
it felt like they took this Q-tip up my nose and just kept just kept going till they tickled my brain a little bit.
Yes.
Um, but I've also heard of saliva test,
Mhm.
uh, finger pricking antibodies, blah
Right.
blah blah. Again, I'm not a medical doctor, but since we got you on there, can you just talk about the test, what you know about it, what the pros and cons, and blah blah blah.
So yeah, you were talking about 2 different tests. So the one that they go way up here in your brain, nasopharyngeal. You can also do nasal. They came out with the nasal test, so don't just have to go through the perimeter. That is testing if you have the virus or not. Those tests are not. Every test is not good, and so they're still working on those tests. So even if you, for instance, come out with a negative test, if you have symptoms, you still should treat yourself as positive. And then the blood test that you're mentioning is testing for antibodies. So antibodies, your body mounts antibodies once it's been exposed to something. And so that's the way to let us know that you may have had a past exposure with the blood. So those are 2 different tests that you're mentioning.
So one test tells you if you got it, and
Now,
then right now, and then the antibodies test let you know if you had it.
you can, yes, if you had it. And then
Why
one of
would
the
you?
problems with the antibodies test is people think that they have had COVID in the past, they are exempt forever, which we are now know that's not true. I think someone came out this week or something and got reinfected again with COVID because it's a virus, right? And so viruses changes. So the antibody test is kind of giving some people a false hope, thinking I've had it and I'll never get it again, and they go out without their mask and stuff, and that's not true.
So knowing that, I guess what's the point of the antibody test?
So one of the point of the antibody test is that we're noticing that those people who have been exposed to the virus, they can give plasma or blood, some of their blood to other people, especially the ones that have been hospitalized. There's been showing that there is some benefit, and they're still working on that now. So let's say if I have the virus, my antibodies are positive. I could later donate, just like you donate blood at the American Red Cross, you could donate the blood and they can give those bloods to people who are, in the IC unit with COVID. And so um, there has been showing some help with those patients, and they're still working on those bugs as well.
Okay, so that leads me to then treatment then, because like we said, this is so new. This is
Mm-hmm.
what they call a pandemic, which
Mm-hmm.
I guess means global. Um, Correct me if I'm wrong.
Right.
And so, what kind of treatment then is that part of a treatment, or is, is there a cure? Which I don't think there is, but again, I don't watch the news, so do they think they coming out with a cure? Is the antibodies part of a potential cure? If that's not the cure, how do you treat this?
So we're learning about it on an everyday basis. There is no cure for it. What we're doing is supportive care. So we're supporting you while you're sick. So for instance, if your child has rhino season coughing, obviously you don't give antibiotics, you don't give antibiotics to viruses, but you support them. So you support them, make sure they're getting their rest, make sure they're drinking enough. So you're supporting the people. So the people who are in the ICU, you're supporting them until they get over this hump. There are drugs that they're trying to figure out to see if it can help, but right now we don't have anything concrete. So it's supportive care therapy right now.
Okay. Um, and I also hear, like I said, I don't watch the news, but I also hear uh, vitamins.
Mhm.
I made sure
I
it's
see.
just a multivitamin.
Okay.
So I've been, matter of fact, I'm gonna pop a couple right now.
Don't
I've been
overdose.
hearing about my mom taking my vitamins. I've been hearing about vitamins. What role do vitamins play at this, if any? And then vitamin D. I think I've heard you or somebody speak on vitamin D before. What's the significance in that?
So, whenever someone's sick or going to be sick, or even right now, you want to boost their immune system. And so, vitamins can boost your immune system. So, when you get in contact with a virus or a bacterial infection, you have a little bit more, I don't know, guns in your holster or whatever. I don't know why I said guns, but you're a little bit more prepared for it. And so, one of the things that we make sure people drink is like vitamin C, right? You know, vitamin C can help be protective when someone has a cold. And so that's where the vitamin aspect comes in.
Okay.
Vitamins, not just vitamins. So it's vitamins, sleeping, rest, exercise. Those are things that everyone should be doing on a daily basis, actually, um, to prepare your immune system or boost your immune system. So if it is in contact with something, it can fight.
And what about vitamin D specifically? Why do I keep hearing vitamin D, getting it through the sun and blah
So,
blah?
so there was a study that came out not too long ago saying how vitamin D is may be decreased in those people who have COVID-19. But essentially, vitamin D, vitamin C, they all anti-oxidative type mechanisms, and so those are the type of supplements that help boost your immune system.
Okay. Um, in a moment, we're going to bring on our lead technical personnel from the church, Brother Greg Aarons. One more question before I bring him on. Antibiotics, what does that do? And what is it?
Antibiotics, sure. Antibiotics is for a bacterial infection. These are viral infections. So there's no, they won't help. Just like when your child has a common cold, you don't give them, you should not give them, but you don't give them antibiotics. Only time antibiotics come into play is if, let's say, I've had a virus of some sort and my immune system is so depressed that then I get a bacterial infection on top of that. And then that's when you use antibiotics. But antibiotics is not used for viruses.
Okay, you got to slow that down for me. All this medical jargon.
So
The so I'm not even sure the word you said, but I heard bacterial infection.
uh-huh.
What when did that come in to?
So it didn't come in. It only came in because, let's say you're sick, right? And so let's
Right.
say you have the flu. Your body is overcome by the flu, that its normal mechanism is has to fight other things, it can't. So you get another infection on top of that. That may be a time where antibiotics is needed. But for a viral infection like COVID-19 or flu, we don't, or and other viruses, you don't give antibiotics for those things. So there's no role in antibiotics typically for COVID-19.
Wowzers. Okay. Okay. All right. So at this time, let's bring on Brother Greg Aarons, and he's going to be answering or um, presenting any kind of online comments that may be there. And he might have a question for you also. I'm not sure. Let's welcome Brother Greg Aarons.
Good morning, Dr. Works. How
Good
are you?
morning. How are you?
A couple questions from our online viewers. How long is the virus active on a surface?
So last time I checked, I think it was 3 hours, but it also depends on the surface. If it's metal, if it's wood. So there is a different half-life for each one.
Um, how does COVID-19 impact infants?
So there are, so typically the people who are having the worst issues with COVID-19 are kids under the age of 1 year old. And essentially it's a viral illness. So what happens, they breathe it in and it goes into their lungs, and then they have some respiratory issues, meaning they have a hard time breathing. So that's how it typically presents with children with under the age of 1. And so,
what are some of the practices we can do to prevent that?
So the infants are not going right. The infants are not going anywhere. So it's the adults around them, right? So the adults around them need to protect themselves when they go out in the world. If they're sick, stay away from the infant, wash their hands, not kissing them on the face and all that stuff like that. So the infants, they're not really going anywhere. It's just the people around them.
So this is my question. Can you tell us a little bit about your educational path? I think when we have kids on watching, it's good that when they see a doctor to understand how you became a doctor.
Sure. So become a doctor in general, it's 4 years after 4 years of high school, and then you go to undergrad or college of your choice for 4 years. I went to South Carolina State University. I was a college athlete. After that, I personally went to grad school, but you don't need to do that. And after college, you go to medical school. So I went to medical school, and then to be a pediatrician, it was a three additional years. So that's my career path. One thing I want to mention, I usually mention to all kids, is just pray about it and hold on. It's definitely not an easy path to take, but it's obviously doable. There's a lot of people out here who are doctors. There are going to be some kind of, I usually tell people this because it doesn't bother me. I have ADHD and dyslexia. And so sometimes that work speaks to people because it can be hard, and let them know that it is possible.
All right. Thank you, Brother Greg.
Are the tests that you spoke of, one more question, are the tests that you spoke of same for adult and children?
What, for COVID-19?
Yes.
Yes, they're the same tests.
Okay, thank you.
Welcome.
Forgive me, Brother Greg. Thank you. Thank you so much for that. And Dr. Works, we're about to wrap this up shortly. Just a couple more things. Biblically, all right. I'm gonna go to the Bible real quick. People need the Bible. All right. In Proverbs 17 and 22, and if you're watching online, you ain't got to turn to it. Just listen. It says, "A merry heart does good like a medicine, but rottenness dries the bone." So my question to you is, how important, in a practical sense, I guess, does an actual good attitude, say you're going through this or anything else, how important is that good attitude, that merry heart? How important is that health-wise to you?
Right. So a strong mind and a strong heart, there's nothing stronger than that. There's nothing stronger as far as medicine or any other doctor. If you have that mindset that you're going to be okay and doing things healthily, living and working out, all of that stuff, it's very doable, and very doable. So the mind is a very strong thing, very strong thing.
Very good. All right. So for the last thing, I'm going to minimize myself. And Dr. Works, I just want you to talk, look right in that camera, talk directly to those kids. And again, parents, grandparents, uncles, aunties, if you got kids, have them stop what they're doing right now, because Dr. Kimberly Works is going to speak directly to them and just let them know your biggest takeaway and whatever else you think they need to know. Um, Speak directly to them as I minimize myself.
Okay, so the main thing, one of the main things is wear your mask. Wear your mask is kind, even though you have a strong immune system and so forth, the person beside you may not. And then also something that we're kind of forgetting with COVID-19 sometimes is the social and mental aspect of it. Being at home and not seeing your friends. And, like our kids last year, they weren't able to go to prom and graduate, or the kids now who, like my niece is a ninth grader, and you're not going to experience walking down the hall as a ninth grader. Just know that your things that you're feeling is valid, and it's valid. Essentially, that's it. And so if you need someone to talk to, try to talk to your friends because they're going through the same thing. And you have your parents. But one of the things that's overlooked numerous times is the mental aspect, because that gets lost. We are, as a society, we're getting better at recognizing or being respectful or kind to people who have depression and anxiety. We're getting better with that. And so that's the main thing I would say. So yes, the virus is here, but how you're dealing with it is most important. I had a patient this week who was 12-year-old who was peeing on himself and he didn't know why. And so let's talk about them. Number one reason why people regress in urination is because they're stressed out. And so when you're talking to him, he was stressed out. He is ADHD. He was having trouble last year in 6th grade, and now everything is virtual. And so he's scared to fail. And so, of course, that's stress, and he's not sleeping. And so one of the things I want to make known is you need to talk to your children, because they're going through a lot, and they're also going through you, seeing what you're going through, because there are a lot of families who are financially hurting right now. And even though you're not thinking your kids see it, they see it. So they see mom and dad fighting, they see mom and dad stress. And so that is affecting them as well. So we have COVID-19 and the virus and all this other stuff, but everyone needs to be mindful of the mental health issues that may or may not going on with children right now.
Dr. Works, thank you so much for taking this time out. I lied to you on the time frame. Please don't hit me. Please feel free to look up Dr. Works. There's the website underneath, as you see it there. Pediatric Works is the name of her business. Founder and CEO, located near Atlanta, Georgia. Let's all give some thumbs up, some likes for Dr. Works. We appreciate you.
You're welcome.
Let's pray out, and then I'm gonna put up another graphic. Thank you again, Father God. Thank you for this opportunity to talk to Dr. Works. Thank you for her. Bless her for this. Let all of us feel safer and more at ease. Take away the fear. In Jesus' name we pray. Amen.
Amen.
All right, until next time.
Bye, guys. Love you.
Love you too.